All right, welcome everybody to our talk on COVID-19 recovery, a physical therapy approach to long-term physical conditions. I will be presenting alongside David and Aaron today, so we'll be switching around. Just bear with us on that. All right, so what are we discussing today? Our goal is to discuss the common long-term physical conditions that could follow a COVID-19 infection, and to help spread the word about how we as physical therapists can help with this. So APTA has now started this PACER project, which is the Post-Acute COVID-19 Exercise and Rehabilitation Project. And they're now offering continuing education courses on how to treat these COVID long haulers. So what are COVID long haulers? New studies are suggesting that around 20 to 30% of symptomatic COVID survivors are going to become long haulers. So these are patients that are still having symptoms after an acute infection of COVID for months later. So we're talking past 12 weeks, maybe up to a year. They're still having symptoms following having had COVID many months before. So it's something that is being studied currently. We're not sure why these particular patients are becoming long haulers and having symptoms for so long, but new studies are coming out constantly about it. So let's just talk a little bit about what long hauler symptoms are. The biggest complaint that we're finding with these patients is debilitating fatigue. So patients are unable to really even go back to work sometimes because then they're out for an entire day afterwards or days afterwards because they are having so much fatigue from just whatever reason, we're not sure why. Again, other symptoms include coughing and shortness of breath, body aches, joint pain, continued loss of taste and smell, and even if this did not occur at the height of their illness, they may experience it later. They might have difficulty sleeping and headaches, and they could have brain fog, so maybe difficulty concentrating, some memory problems, really interesting stuff that's just being studied right now. And like I said earlier, around one study found that over 30% of COVID patients who had been hospitalized had persistent symptoms at 60 days post initial symptoms. So this is a huge number of patients, potentially could be a huge number of patients. And it's something that we as physical therapists are going to be looking at as we might be getting patients who could be COVID long haulers. So the systems involved with COVID, we know it's a wide-ranging multi-system disease, and the long hauler symptoms can also be wide-ranging. So you could have pulmonary and cardiovascular damage that they're suspecting could be permanent. That's also being studied right now. Hematologic systems could be involved. So your blood, you could be at higher risk for blood clots after the fact, or during COVID, of course, but also afterwards. Neuropsychiatric, renal, endocrine, GI, hepatobiliary, and tegumentary. So what experts are now recommending with these long haulers is that we should be forming specialty clinics for these survivors, and they should have providers from multiple disciplines to take care of them, because these patients might be presenting very differently from one another, so they will not have a one-size-fits-all treatment approach. So since acute COVID symptoms can last for a long time, often 3 weeks or more, these are acute symptoms, so we're thinking in the hospital, maybe in the ICU, we're going to see, as physical therapists, extreme deconditioning. So that's expected when you have prolonged sickness, especially if you've been in the ICU on a ventilator, for example. You're not going to have moved for many weeks, so your muscles are going to get really weak, including your diaphragm, which is a muscle. We're going to talk about that a little bit later. And this is going to affect your ability to sit up. It's going to affect your ability to walk, any activities of daily living. So this is something that we as PTs are trained to address. Prior studies have shown that low intensity training for 6 to 8 weeks and interval training are effective PT approaches for a deconditioned patient. So other treatment strategies we might use as physical therapists are practicing simple breathing techniques. So pursed lip breathing to help conserve energy, and doing really gradual exercise and breathing with the exercise. So matching our breath with movement, and then really pacing ourselves, or making sure the patient knows how to pace themselves, because again, this fatigue can be extremely debilitating after having COVID. So we have to make sure that the patients don't push themselves too far, that then they end up being down and out for days afterwards. So the diaphragm. We're probably going to have a lot of weakness, a lot of diaphragm weakness, post an acute COVID infection, because COVID does affect the lungs so much and it affects our ability to breathe. And so we know our diaphragm is primarily a breathing muscle, but it also acts as a trunk stabilizer and a postural muscle. So with diaphragm weakness, of course, we're going to have much more shallow breathing. We're not going to be able to fill up our lungs and expand and breathe normally as we would. But we could see low back pain with having this diaphragm weakness, just because it is also a trunk stabilizer and helps to stabilize the spine. You could also just have low back pain from being in bed for many weeks at a time and not have moved, so if you were in the hospital with COVID. So something that we'd be working on as physical therapists to address this diaphragm weakness would be first this simple breathing patterns, some neuromotor retraining of breath patterns, some diaphragmatic breathing, rib expansion breathing, to help decrease the work of breathing, and then help strengthen the diaphragm back so it's working how it should be, and then ideally, that would also help decrease any other, muscle aches and pains that might just be because the diaphragm is weak. We'd also want to do some manual therapy, likely to the muscles around the rib cage, those intercostal muscles in between the ribs, because they're probably really tight from not having moved a lot. If you're taking really shallow breaths, your ribs weren't really expanding and contracting as much as they could have been. So your muscles are going to be really tight around there. So that would be something we'd also work on in physical therapy. And then I believe David's going to take it from here.
Okay, so I'm going to talk a little bit about the lungs and how the virus causes fibrotic scar tissue to be kind of laid down. So the lungs are kind of like a soft, squishy material, kind of spongy. And when you breathe in, it kind of expands and blows up like a balloon. At the end of the tunnels that kind of go down into the lungs are little kind of spherical grape-like bunches called alveoli. And that's where all the gas exchange occurs for carbon dioxide and oxygen to get into the blood. And so when there's scar tissue, it kind of hinders that, decreases that exchange, but it also leads to an inability to be elastic and fill up. So oftentimes, it's hard to really expand your chest because it's being pulled down from the inside with the scar tissue. And so you get this posture, it's kind of like hunched over, you can't expand your rib cage. It prevents you from breathing fully in. So your lung capacity is diminished. And then after a period of time, the muscles on the outside and the fascia around the muscles kind of pins you in that posture. It kind of constricts and tightens externally as well. So you can't sit upright, you can't expand and get a full breath. So when that's going to affect your ability to breathe and sit upright, and when you don't expand your rib cage, you lose that ability over time. Especially, you've been in the ICU, you've kind of been laying around in bed, you've been sitting on the couch, kind of recuperating, and so you can't move, you can't open, and then when it happens, it's hard to twist, it's hard to expand and kind of extend your trunk backwards, so you get in this kind of slouched, they call it kyphosis posture, and when that happens, you get the shoulder blades. So the shoulder blades are kind of wings on your back, and so when you're hunched over, those wings can only swing up so much. So raising your arms get affected. You can't get them up over your head. So like that's about as high as I can raise my arms sitting in this position. So, but if I sit up nice and tall, I can go all the rest of the way. So that can present as like shoulder pain issues, you know, kind of mid-back pain between your shoulder blades. So we have to kind of address that posture, slumps posture, kind of get the fascia on the outside to really expand, to open the chest up, get the shoulders kind of nice and pinched back, the shoulder blades, opening up that rib cage. So we do that by myofascial release. We kind of do manual therapy techniques to stretch the fascia in different directions, diagonally, up, out, kind of expanding everything. And a lot of times what we do is we call it bucket handle. So the ribs kind of roll and expand outwards from the side. So we do a lot of the manual therapy, trying to lift and expand and time it with the breath in. So we kind of expand, really open up, stretch, and then breathe in to really stretch that fibrotic scar tissue from the inside as well. So kind of doing an inside-out approach in addition to that. And so by kind of restoring that posture, we're able to breathe in more, expand the chest, and then also increase the range for your arms and shoulder as well. So going back, and when we're in that slouched position again, kind of sitting like this, we can't breathe through expansion of the rib cage. So what happens is the muscles in through the neck, in the front of the neck, kind of help. So, but the breathing is more vertical. It's like really shallow, deep breathing, or shallow breathing. So it's more like a gasping for air up and down. So it's more of a conscious effort. It's not an automatic and easy. It's very energy inefficient to breathe through the accessory muscles. So if you can try it yourself, kind of slouch over and kind of get your fingertips right above your collarbone, and you take a deep like gasp in, those muscles really activate. Those are the scaling muscles on the front of your neck. So that can lead to like forward head posture, headaches, things like that. So we're kind of addressing all around the rib cage, up and around the abdomen. It's kind of like the accessory breathing is like the feather that broke the camel's back. Like, you know, you can't expand your rib cage, but then you're also like using these tiny little muscles to breathe in too, and it adds some more discomfort. So how do we kind of address that? We kind of retrain the same way. We open up, we kind of address the posture and coordinate the breath in. So if you think, as you breathe in, you're raising your arms up, and that helps pull on the rib cage because the pectoral muscles kind of attach from the arms to the rib cage. So you're really expanding that whole chest, and you're reteaching your body to use all the muscles, the intercostal muscles on the ribs to expand that rib cage instead of using these tiny little neck muscles. So everyone can kind of try that by sitting on your sit bones, really nice and upright. Breathe, deep breath in, and expanding that rib cage, that bucket handle swinging up from the side of the ribs. So when there's a difficulty with expansion of the ribs and breath control, we also have some kind of trunk weakness too, because we haven't been moving, we've been laying in bed. The muscles in the abdomen, they're weak, they're deconditioned, but then we also can't take a deep breath to fill it in. So a lot of it is like diaphragmatic breathing. We fill in our belly and we kind of have more additional trunk support. It's kind of like an unconscious effort. If you're ever like lifting things and you're holding your breath, that's the intra-abdominal pressure. The breath filling up the lungs creates a pressure to support the ribs and trunk on that from the inside. So again, we kind of help maintain that upright posture, expanding the lungs, filling the lungs and the rib, opening the rib cage to allow the breath to be drawn down into the belly, using that diaphragm to help regain some of that intra-abdominal pressure, the capacity, lung capacity. So since we're addressing the trunk and the core now, in both sitting and standing, when that's affected, that's like your center, right? That's where your foundation of all your strength is. When you're sitting and standing, all the movements come out from there. So you're going to have weakness and kind of when you're moving your arms and your legs, it's just like they're hanging on to this noodle core, right? And then you move that, and then everything kind of moves along with it, and you don't get the stability that you need to balance. So walking, standing are all going to be a lot more difficult when you can't have that good core strength and kind of internal pressure. So the next thing we wanted to kind of demonstrate is called the breather. So how we kind of work on expanding that lung capacity and opening up the lungs from the inside is some resistance. So we start off with a little bit of resistance. So if we can come over, Kate will kind of show you how this works. She's tried this out. So basically it's called the breather. You put it up to your lips, and it kind of adds resistance when you're breathing in. And then it's kind of like weight. It's like weight resistance for your lungs. So you have different settings, and then when you blow out, it has a different resistance, a setting on the other side. So you can, you can change the resistance depending on where your level of strength is at that time. So as you get stronger, you can, with the inhale, you can increase that separately from exhaling and blowing out. So that's the breather. So that will help kind of address the lung capacity and improve your fatigue level. So because when it's easier for you to breathe, you're kind of strengthening the lungs and the inhale and the exhale. It becomes more natural to breathe, and it takes less energy, so it helps lower fatigue as well. And then, so moving down the body, we did the chest, diaphragm, and now we're going down to the what's called GERD, gastrointestinal esophageal reflux, so acid reflux. So especially when we're in that slouch posture, there's a lot of pressure on the stomach, over on that left side, kind of right under the ribs, right here. And so when there's a lot of pressure, the contents get squeezed, and the contents being squeezed in the stomach kind of forces it up too. And the diaphragm helps kind of draw everything down, giving that space. And then when that's weak, it also increases reflux. Additionally, there's a nerve that goes right through the solar plexus. So when you're kind of sitting in that posture, that nerve gets compressed too, and that innervates all the gastrointestinal kind of tract. Also, it all kind of comes together, leading to that acid reflux. And we kind of address it in the same way. We kind of open our chest up, really allow that belly to fill up, drawing down, giving the stomach some room to spread out, taking some pressure off of the vagus nerve. And that's like the whole kind of trunk expansion. So it's a similar kind of treatment style for all of it, getting everything to open up and expand. So the next section, I'm going to hand it off to Erin, and she'll kind of address the throat and vocal fold training.
Okay, let me get my screen share. Okay, so I'm presenting remotely, so bear with me if there's any technical problems. But I will go ahead and take over from here, and I'd like to talk about the involvement of the vocal folds and the impact of mechanical ventilation. So with the endotracheal tubes, when they're inserted, they pass through and press against the vocal cords, which can lead to injuries like little knots or nodules on the vocal cord, abrasions, or even swelling of the vocal folds, or it can even involve a little bit of nerve damage as well. So these injuries can either be short-lived or potentially more permanent depending on the extent of the injury. So shortness of breath during speech, or weakness or hoarseness of the voice, are some signs that there may be some injury to those vocal folds. There we go. So the vocal folds are important in the generation and maintenance of the core or trunk pressure. And I think David has touched on this earlier as well, about trunk pressure and maintaining pressure within the trunk and the importance and stability of the body. So the vocal cords, injury to the vocal cords, can actually cause or sort of manifest with problems in balance, weakness in the limbs or the extremities, or can even show up as constipation. So here's an image that just sort of demonstrates the three diaphragms of the body. So up at the top, we've got the vocal folds, which act as a diaphragm up here. In the middle, we've got the respiratory diaphragm down kind of in the abdomen. And then at the bottom, we've got the pelvic floor. This is where I get excited because I'm a pelvic floor PT. So we need good function of all three of these diaphragms. And we need them all working together to help maintain the balance within our trunk, the pressure, the balance of pressure. And that's important for transferring load through the trunk and maintaining that pressure while we move or while we reach an arm or a leg. We need good trunk stability. So trunk stability and breathing are therefore linked pretty intimately. So if our vocal folds up here are not opening and closing properly while we breathe, speak, and move, we might end up with some altered stability in the trunk, which again manifests in balance difficulties or even other musculoskeletal problems like pain, back pain, neck pain, shoulder pain. So also to touch on the pelvic floor, something to keep in mind as possibly maybe a side symptom or long-term symptom would be either a change or an onset of either incontinence or even constipation post-COVID, which could suggest that there's altered mechanics of either one or all of your diaphragms, the vocal, respiratory, and pelvic floor, which means altered pressure management in the trunk. So kind of a side thing there. So when it comes to treatment, some strategies here. So it's important to vocalize. We don't want to completely avoid using your voice. Rest is good, but we don't want to rest for so long that it can cause any disuse atrophy of the muscles. There's already some degree of disuse atrophy throughout the rest of the body due to, being in bed for so long. But we don't want to kind of continue that even through the vocal cords if there's been any damage to those muscles. So it's important to start using the vocal cords as regularly as possible, resting if your voice is stressed or strained. But some other strategies include counting out loud as you exhale, as you breathe out, singing or humming. It's encouraged to speak with some level of volume, but we should also avoid straining to speak more loudly, especially for longer periods of time. Practicing vocalizing more loudly, but not overdoing it. We can overuse this muscle group just like we can any other muscle in the body that's recovering. Voicing or vocalizing, speaking during postural control training has been found to help improve balance and confidence with transfers and walking in early rehab. So this can be and implemented pretty early. And then, of course, speech therapy might be indicated for more severe or persistent cases affecting the vocal cords. So prior to COVID, most patients are likely able to generate, regulate, and maintain pressure in the trunk for breathing and postural stability. But post-COVID, these might be some things that patients need to relearn afterwards. So treatment should involve breathing strategies, but also training for postural stability. This is a multi-system condition, and musculoskeletal symptoms like decreased shoulder range of motion or neck pain, back pain, or even balance problems or weakness, feelings of weakness in the arms or legs might not come solely from the musculoskeletal system due to deconditioning, but can also be related pretty specifically to the respiratory impairments due to COVID. So we need to look at this as a real multi-system condition and a sort of multifaceted approach to recovery and treatment. So overall, physical therapists are well equipped to be part of the medical team to help improve posture, balance, breathing, and overall function. So spread the word about physical therapy if you have any friends or family affected by COVID and feeling the long-term effects of COVID-19. And keep in mind also that research is really rapidly evolving. There's new information coming out on a weekly basis, daily basis. So there's a lot of updates coming out about treatment approaches as well. So for now, we treat everyone as a case-by-case basis, knowing that it's can be a complex condition after. So it's important to listen to our patients and let us know how you feel.
So I've treated a few patients who've had fibromyalgia. It's, from my understanding, it's an autoimmune response as well. And COVID, they've been finding a lot of kind of autoimmune-like symptom, like a relationship with the COVID as well. So it's a similar kind of addressing, a lot of posture, a lot of kind of psychosocial pain centralization that we had a talk earlier in the series about pain. So knowing that your pain is real, but we can kind of have some techniques to tune it down and lower the volume. So we can get you back to movement, kind of gradually increasing your activity levels will help with both pain from fibromyalgia, but increasing your capacity to do more activity and getting you out of a cycle of pain, discomfort, less activity, kind of depression. All of these things kind of add onto your plate and weighs you down, hard to get motivated. So kind of slowly reintroducing activity helps break that cycle, and so you get more movement, just blood flow in the whole body. A lot of the body systems work most efficiently with movement. So it helps get more energy because it's more efficiently using the energy that you have, retraining breathing and heart capacity. So I don't know if you have anything else to add. But.
No, I think just the biggest thing I'd say is activity pacing, and just pacing with that, especially with chronic fatigue syndrome. All right. Just real quick, we wanted to also thank Mary Massery, who is the physical therapist that had started to put together these webinars on COVID-19 long haulers, which it's a course that Molly and I both took in order to give this webinar presentation. So she's doing a whole lot of work on that right now. So I just wanted to cite her as our primary resource for all this information.
Thanks for joining us.
Thank you so much.